Functional movement screen is a screening process that we use to identify movement dysfunction or deficiencies in an athlete, and then we can use that to help direct their training program moving forward. A movement deficiency would be a movement limitation that a person would have, or it would be an asymmetry from side to side. So one side moves differently than the other side, and that asymmetry can lead to abnormal stresses in the body, and those abnormal stresses can then lead to injuries. So movement deficiencies or asymmetries can lead to compensation in the body, and when you have one area that isn't moving properly or wasn't trained to move properly, that will put excess stress on another part of the body, and with that excess stress it can really lead to increased pain, or it can lead to a breakdown of that tissue, which can then complicate into even more problems over time. So identifying those will be very important for an athlete to avoid some of these injuries in the future. A good example would be if an athlete is injured, so they injure one knee. Over time, whether that's treated or not, they may end up with some compensations in other parts of the body. So if they injure their left knee, they start moving differently as a result of that left knee injury. That leads to their right hip becoming dysfunctional because they're trying to compensate for the left knee injury. As that right hip starts to become a problem, then that ends up causing some back issues because they're moving differently through that right hip. And as you can see, that can really lead to kind of a whole host of problems, from the fact that the left knee was the one that was injured first, that led to the right hip to become a problem, and now the lower back is becoming a problem. So as we get into this issue where you have multiple areas affected, sometimes it's hard to identify what is the problem and where was the problem started in the first place. The functional movement screen helps us to identify those movement deficiencies, and then that helps us to direct some treatment. When there's a movement deficiency detected, the functional movement screen helps us to identify where that movement deficiency is coming from, and then we will be able to come up with either corrective exercises, or if there's pain involved, we'll be able to initiate some treatment in physical therapy to help reduce that pain and get them back to their training regimen as they really want to do to return to their normal sport. An athlete should look into getting a functional movement screen before they're starting a new performance improvement program or a new strength program to identify where they may have some deficiencies. Identifying those deficiencies from the beginning is very important, and then throughout the program is always a good idea to help to monitor their progress and make sure they're truly identifying those deficiencies to help them become a better athlete. So if an athlete improves their movement patterns, that can improve their ability to efficiently generate power and speed, and that should improve their performance and certainly has the potential to reduce their risk for injury. So the functional movement screen is a series of 7 tests that we do to identify movement deficiencies. The first of those tests is the deep squat, and that squat test is going to identify the ability to get all the way down to the floor, as well as some of the core stability that's required. So we're going to do an overhead press, feet pointed straight directly forward, and a deep squat all the way to the floor, keeping the bar directly overhead and then coming back up. Deficiencies may lead to the inability to squat all the way down or leaning forward. If that is the case, we're going to have to make some compensations with the testing procedure. Another thing that happens oftentimes is you will find a lot of valgus of the knees, or the knees come together when they go down, which may indicate some weakness in their hips. So this is one of the tests on the functional movement screen. It's called the hurdle step. And what we are looking to do is keep really good alignment and good control while we're stepping over this hurdle. So you're going to do one leg at a time. You're going to keep very good balance and control, stepping over, touching the heel, coming directly back, and then you're going to do that same exact test, same exact movement on the other side. And what we're looking for is really good balance and really good control while everything stays in alignment. One of the, or a few of the compensations that we find, oftentimes you'll have people that need to lean or swing their leg around as they try to do that. Sometimes their balance is really poor and they can't maintain balance at all during that test, or you will notice a lot of leaning from side to side through their upper body, which indicates poor control through the trunk and through the hips. The shoulder mobility test is another one of the functional movement screen tests. And with this test, we're assessing how well their shoulder and shoulder girdles move. So we're going to have them stand with their feet together, thumbs inside their fists, and they're going to take one hand up and one hand back and try to touch them in the middle of their back, or at least get them as close to one another as possible. And we'll assess the difference between the two sides and whether they are within a normal range that we're looking for.